We are back with Democratic Congressman John Larson of Connecticut and Republican Congressman Mike Pence of Indiana. We were talking about the cost of this. The CBO has said over 10 years, this health care bill will reduce the deficit by $143 billion. However, that doesn't include what might come and what's been promised with more than a wink and a nod to doctors, which is to up their Medicare payments, their reimbursements, which would cost $208 billion, which then means it actually would add to the deficit. Is my math correct there?
Well, if that were to be true. But here's the thing. There's no question about the fact that we need to take care of the docs and we need to emphasize primary care. But also what never gets discussed, Candy, is something that Reuters came out with earlier this year. $700 billion annually in inefficiencies in the system, lack of interoperability in hospitals, lack of a continuum of care, and fraud and abuse. $700 billion. I think that that's $7 trillion over a 10-year period. I think that we're more than going to be able to wring out the cost in there. I think that's why the president brought people down to Washington, to the White House. That's why he brought the 6 in, to try to wring out those costs as we go forward. You know, we spend 20% of gross domestic product. The closest country to us is Switzerland. I can't believe that we can't get that money out of there.
Can't we get that money out?
Yeah, we do such a great job here in Washington wringing out the cost.
Well, that's in the private sector.
$1.6 trillion deficit this year. You know, only in Washington, D.C. Could you say with a straight face that you're going to spend $1 trillion and save taxpayers' money? Look, you point out the doc fix. This is a total fraud that Democrats are leaving out $200 billion in spending that the Speaker of the House committed again this week to spend, which makes this, even using this CBO's numbers, it makes this a bill that adds to the deficit in the short term and in the long term. But look, even beyond that, Candy, the American people know, but you expand the federal government's role in health care without giving the American people more health care choices by purchasing across state lines, without passing any medical malpractice reform at all. Roughly a third of health care costs in this country, I hear, are actually defensive medicine driven by junk lawsuits. The American people know this is going to cost more and add more to the deficit, add more to the debt, cost higher taxes even than the rosiest scenarios that are presented.
CBO is the Bible.
It is, but it's not always accurate, as you know.
We have arguments with them all the time, but that's all that we can. That's all that we can vote on.
Absolutely, but it still is one of those things that we might not find out except for 10 years from now.
And the President has put in numerous reforms that are going to take effect, including the inability to rescind your insurance policy, pre-existing conditions for women across this country. Candy, I mean, their birth is a pre-existing condition. Domestic violence is a pre-existing condition. A C-section is a pre-existing condition.
My wife had a pre-existing condition. I lost my job about 15 years ago. My wife had a pre-existing condition. She was pregnant with our daughter, Audrey. We went to the State Guarantee Fund, a fund that would be replenished if we passed medical malpractice reform. We could use the savings to strengthen those funds to cover people like my wife was covered. You don't need a government takeover of health care. You don't need to mandate that every American purchase health insurance, whether they want it or need it or not. And you don't need to put us on a pathway towards socialized medicine. And that's what this crowd is doing today.
Let me ask you something. Just turn you in.
Runs Medicare currently. TRICARE is run by the government. Where's the takeover of government?
Well, I'll break it down, John. If you mandate that every American purchase health insurance, you mandate that every business provide it, you create incentives so people end up in government-run insurance, and you provide public funding for aboltion, you mandate insurance plans cover it within the exchange.
There is no funding for abortion in this bill. There is no funding for abortion in this bill. It follows Hyde. That's the case.
You know that's not true. The Catholic Church, the Catholic bishops, the right to life says
60,000 nuns
public
can't be
funding for abortion.
Thank God for the Sisters of Notre Dame. That's what
let me call it time here because we are out of time. But for more of this, our audience can tune into the House debate starting this afternoon. I suspect that even pass or not pass, this debate continues.
That's right. There are strong disagreements, but Mike Pence is an honorable man, and I look forward to this debate. And as are our colleagues. I hope that we do ratchet down the conversation, though, because when two of our colleagues are spat on and hurled racial slurs, it's time to ratchet down things.
Well, I'll tell you, I was in Selma with John Lewis. If what's reported to have happened was reported is contemptible, I denounce it in the strongest terms.
Thank you.
But I assure you, this
both very
debate
much.
will not end today.
Or
I would agree
probably
with
on
that.
this show.
I agree
Thank
with
you
that.
very much.
There's
I
going to be a
appreciate
lot of work to go.
If health care reform wins passage in the House today, the measure heads back to the Senate.